హాయ్ వెల్కమ్ టు కేర్ సంవాద్ విత్ మీ మిర్చి హిమంత్. నాతో పాటు ఉన్నారు డాక్టర్ జయచంద్ర. సార్ వెల్కమ్ టు ద షో. సో నైస్ టు హ్యావ్ యూ సార్.
థ్యాంక్ యూ.
నేను ఇందాక మీకు చెప్పినట్టు మా దగ్గర బోల్డ్ అని క్వశ్చన్స్ ఉన్నాయి సార్, రెడీ టు షూట్ టువర్డ్స్ యూ.
అబ్సల్యూట్లీ.
సార్ నాకు ఎప్పుడు నా మైండ్లో ఉండే క్వశ్చన్ ఏంటంటే, ఆస్తమా అన్నది అట్లీస్ట్ మన ఇండియాలో బోల్డ్ అంతమంది మిలియన్స్ ఆఫ్ పీపుల్ సఫర్ ఆస్తమా. ఆస్తమా జరిగినప్పుడు అసలు లంగ్కి ఏం జరుగుతుంది, ఏమవుతుంది చెప్పండి.
అంటే ఆస్తమా బేసికలీ ఈజ్ అ డిసీజ్ ఆఫ్ ది ఎయిర్వేస్,
ఓకే,
ది ఎయిర్ ప్యాసేజెస్. ఆస్తమాలో ఏమవుతుందంటే, ఫర్ వాట్ ఎవర్ ది స్టిమ్యులస్, మేబీ అలర్జీ వాట్ ఎవర్ ఇట్ ఈస్, ఇట్ సడన్లీ కన్స్ట్రిక్ట్స్.
Okay.
It becomes very narrow. Instead of breathing through a broad tube, suddenly it becomes narrow. It is as if you are breathing through a straw. That is the basic issue.
ఓకే.
The second part of it, which is often forgotten, is it also causes some inflammation of the tubes.
Okay.
అంటే ట్యూబ్ లైనింగ్లో వాపు వస్తుందన్నమాట,
ఓకే.
which further worsens the narrowing. That is the main thing. So, పోగానే you take that inhaler or a nebulizer these days, which is the fashion of the day. తీసుకోగానే కొద్దిగా రిలీఫ్ వచ్చేస్తుంది. But it doesn't treat the inflammation of the tubes. So, asthma is not something that you take it once in a way and you're okay. Asthma is a long-standing problem which requires long-term treatment and regular treatment to prevent it from coming on. వచ్చిన తర్వాత ట్రీట్మెంట్ చేయడం ఎవరైనా చేస్తారు, రాకుండా కాపాడడం ఈజ్ మోర్ ఇంపార్టెంట్.
ఓకే, ఓకే. కానీ అంటే ఇదే ఆస్తమాకి సంబంధించి అసలు ఎవరికైనా రావడానికి ఆ కామన్ ట్రిగ్గర్స్ ఏంటి?
ట్రిగర్స్ అంటే నార్మలీ దుమ్మే కావచ్చు. ఫర్ ఎవ్రీ పర్సన్ ఇట్ ఇస్ డిఫరెంట్. ఫర్ ఎ పర్సన్ ఇట్ ఈస్ పాలన్, వన్ పర్సన్ ఇట్ ఈస్ ఫంగల్ స్పోర్స్, ఆర్ దెర్ ఆర్ సమ్ జనరల్ ట్రిగర్స్. పొల్యూషన్ ఎక్కువైనప్పుడు, స్మోక్ వచ్చినప్పుడు, ఆర్ ఫర్ ఏ హజెఫ్ అది హౌస్ వైఫ్ వాజ్ వర్కింగ్, తిరమాత వేసినా కూడా ఘాటుతో ట్రిగర్ ఏ ఆస్థమాటిక్ ఎపిసోడ్.
ఓకే.
సో ఇట్ ఈస్ నాట్ ఎ స్పెసిఫిక్ థింగ్. ఎనీ నెంబర్ ఆఫ్ ట్రిగర్స్ కుడ్ బి దేర్ ఫర్ ఎన్ ఆస్థమా.
ఓకే.
అంటే ఆస్థమాలో ఏమవుతుంది, ది ఎయిర్ ప్యాసేజెస్ ఆర్ ఎక్స్ట్రీమ్లీ సెన్సిటివ్ ఫర్ ట్రిగర్స్ అనమాట. ఇట్ కుడ్ బి అన్ ఇరిటెంట్, ఇట్ కుడ్ బి అన్ అలర్జన్, ఇట్ కుడ్ బి సంథింగ్ ఎల్స్, or your sense or your other or whatever it is, they can trigger off a asthmatic episode.
సార్ ఇందాక మీరు ఇన్హేలర్స్ గురించి చెప్పారు కదా సార్, ఇన్హేలర్స్తో వచ్చే డేంజర్స్ ఏంటి? అంటే అడిక్టివ్ అయిపోవడమా?
అడిక్షన్ అనేది ఏమి ఉండదండి. పీపుల్ యూజ్ ఆర్ రిక్వైర్ లాంగ్ టర్మ్ ఇన్హేలర్స్. దట్ ఈస్ నాట్ అడిక్షన్, దట్ ఈస్ ఎ నెసెసిటీ. సో అది వాడితే అలవాటైపోతుంది అని చెప్పడం, దట్స్ నాట్ రైట్. అవసరం ఉంది కాబట్టి ఎక్కువ రోజులు తీసుకోవాల్సి వస్తుంది. యూజువలీ 3-4 months మంచి కంట్రోల్ వచ్చేసింది అనుకోండి ఆస్తమా, దెన్ యూ రెడ్యూస్ ది అమౌంట్ ఆఫ్ డోసేజ్ ఆర్ ది ఫ్రీక్వెన్సీ ఆఫ్ డోసింగ్. అలా జరుగుతుంది. అడిక్షన్ అనేది ఏమి ఉండదు దాంట్లో.
ఆల్సో సార్ ఇప్పుడు క్రానిక్ కాఫ్కి, బ్రాంకైటిస్కి, లేకపోతే ఆస్తమా, ఏ పేషెంట్ అయినా సరే ఎలా డిఫరెన్షియేట్ చేసుకోవాలి?
అండ్ దట్స్ వై వీఆర్ హియర్ యాజ్ డాక్టర్స్ కదా. సో ఆస్తమా ఇస్ ఏ కొన్ని రోజులు ఉంటుంది, కొన్ని రోజులు ఉండదు. విత్ ది సేమ్ లంగ్స్ దట్ హీ హ్యాస్, హీ మే బి నార్మల్ ఫర్ సమ్ టైమ్. అదే బ్రాంకైటిస్, క్రానిక్ బ్రాంకైటిస్ అంటే స్మోకర్స్ బ్రాంకైటిస్ అనుకోండి, ఇట్ ఈస్ దేర్ విత్ హిమ్ ఆల్ ద టైమ్. అది పోదు. వాట్ డ్యామేజ్ యూ కాజ్ ఇస్ గోయింగ్ టు స్టే విత్ యూ. సో బ్రాంకైటిస్ ఈజ్ there for you all the time. Asthma is intermittent. కొన్ని రోజులు ఉంటుంది, కొన్ని రోజులు పోతుంది. యూజువలీ ఇన్ ది బిగినింగ్ ఆఫ్ ది కోర్స్ ఆఫ్ ది డిజీజ్ సీజనల్గా వస్తుంది. వింటర్స్లో రావచ్చు, రైనీ సీజన్లో రావచ్చు. సమ్మర్స్ ఈజ్ పర్ఫెక్ట్లీ నార్మల్. సో దట్ ఈస్ ఎ డిఫరెన్షియేటింగ్ ఫ్యాక్టర్ అన్నమాట.
సార్ బ్రాంకోస్కోపీ అన్నది కూడా మనం చాలా వింటుంటాం ఈ మధ్యన. అసలు బ్రాంకోస్కోపీ అంటే ఏంటి? అండ్ రెండోది, దీని నీడ్ ఎప్పుడు అరైజ్ అవుతుంది?
Bronchoscopy and a procedure, basically it is what? Looking into the air passages. You have a device which is a flexible tube with a camera at the tip and a light, because inside everything is dark. So you need to illuminate the air passages as you are going in with the tube into different parts of the lung and examine everything. This is what bronchoscopy is all about. What can be done with bronchoscopy? One is a visual examination. Second thing is collection of samples, either by way of your sputum or the infected material from the lung. That is one thing that can be collected with the instrument. Biopsy, that is when you see a tumor or you want to sample part of a abnormal looking lining membrane of the lung, you take biopsy. Or you can take a lung biopsy with a bronchoscope. These are all advanced things, but nevertheless can be done with this one.
Okay.
This is as far as the diagnostic services are concerned. Same thing, bronchoscopy can be used for treatment of the lungs. All right. Washing a lung, in some diseases we need to do them, give them a good clean bath, essentially. And that is part of the treatment protocol. It can be used as a treatment protocol, or removing a foreign substance or a foreign body in the lungs. These are all things. Or there is a tumor, you use the bronchoscope and the different instruments which also qualify as bronchoscopes to remove the tumor from the lungs, which are eminently removable by a bronchoscope and who don't qualify for surgery. People who require surgery will go straight in for a surgery. People who are not amenable for surgery, you can remove it through the bronchoscope. So it's just a device to diagnose, to treat, and to further the care of lung diseases.
సార్ అలాగే ఈ లంగ్ డిసీజెస్ విషయంలో ఇమేజింగ్ అనేది వచ్చింది. ఇమేజింగ్ అనేది చాలా ఇవాల్వ్ అయింది కదా, ఎస్పెషలీ ఈ హై రెజల్యూషన్ సిటీ స్కాన్స్ అంటారు. ఇది ఏ లెవెల్ వరకు వచ్చిందంటారు, ఎంత హెల్ప్ఫుల్గా ఉందంటారు?
They're extremely helpful because this qualifies as a invasive investigation. That means without poking needles, without doing anything else, you are getting the maximum amount of information from the person's chest, lungs and other things.
Correct.
Right. Chest X-ray is a basic thing which will give us a two-dimensional view of the whole thing. When you use a CT scan, it scans from all around. Basically, it is a detector which is going all around and it goes in a circle. It's a spiral. Spiral, though, you pick up all the information and the rest of it, the computer built into the CT scan machine, which reconstructs the image.
Oh.
You understand? So you can play around with the images. If you want, you can see the entire air passage, reconstruct the image. You can see the entire thing, outside, inside. If there is a tumor, how much of it is inside, how much of it is gone outside. What are the other vessels and other things which are involved because of this tumor. And other things can be studied by a CT scan. All right. To further enhance the study, we can also do a contrast study. That means you can see the blood vessels in their entirety. Is there anything blocking in the air passages, in the blood vessels, like a pulmonary thromboembolism antam. Ekkadna embolus edana irukkoni unda, yen sangati. So without anything, you put him on a CT table with a contrast, you get all this information. Correct. So imaging is something that you cannot do without. Right. Especially a pulmonologist, I cannot work without imaging. These are the things. Now, next step is you have PET scan antamu, idantamu. There are so many things, and it is also helpful and giving us direction to a particular tumor.
Again, sir, with regards to children, ఈ ఫారెన్ బాడీ ఆస్పిరేషన్ అంటుంటారు పిల్లల్లో. సార్ దీనికి సంబంధించి పేరెంట్స్ కానీ లేకపోతే పిల్లల పక్కన ఉన్న కేర్ గివర్స్ కానీ ఎలాంటి జాగ్రత్తలు తీసుకోవాలంటారు?
One is be careful. Children have a tendency to put everything in their mouth.
Correct.
All right. Now, in our anxiety, we try to remove it. By doing what? Holding the child, trying to put a finger in the mouth, trying to beat him on the back. All kinds of tricks you try to get him to spit it out. But what it ends up as, the child starts to cry.
Correct.
Cry and take a deep breath. And if it still remains in the mouth, it just goes into the lungs. So you're facilitating a foreign body aspiration. Children keep it in the mouth, they get bored, they spit it out or swallow it. So the chances of aspiration are very, very low. But by and large, if you see small children, they do put things, accidents do happen. నవ్వుతూ ఉంటాడు, నోట్లో ఏదో ఉంటుంది, లోపల పోతుంది, ఆర్ ఏడుస్తాడు, నోట్లో పోతుంది. It happens. Or a small child sleeping with something in the mouth will tend to aspirate. These are all things which do happen. They're all accidents. And we are there to help them out when they come on time.
Okay. At the same time, sir, అంటే ఇలాంటిది ఏదైనా ఒక స్పెసిఫిక్ కేసు ఏదైనా గుర్తుందా? సంథింగ్ వేర్ యూ యాక్చువల్లీ సేవ్డ్ ఎ లైఫ్?
Most of these things are life-saving. Let me put it that way. Foreign body in children is a life-saving procedure. That is the bottom line. Like sometimes it goes unrecognized.
Correct.
Child is coughing, they don't know why. Sardi ho gaya, kam nahi ho raha. Basic thing is like that. I can give you an instance where a child had come to me coughing for almost a month or so. If I remember, a 2.5-year-old child or a 2-year-old child. So, as I said, first thing is an X-ray. And X-ray shows a open safety pin in the air passage. Open safety pin. When I asked them, they said, probably 2 months or 3 months the child has been coughing. So the child comes with an open safety pin, 2.5-year-old child, lying across the air passage. Now the challenge is to remove it without damaging the thing. And he is not a surgical candidate. He is not a surgical candidate. So you have to go in with a bronchoscope again, as I told you, and remove it without damaging the airway structures.
Wow.
Right? And the kind of instrument that you use is a 5 millimeter diameter, 30 centimeter long stainless steel tube through which you are seeing. You're allowing the anesthetist to give him the required oxygen. You're operating through the same tube, trying to get hold of the safety pin, take it out without damaging the structures, or trying to close the pin there inside the air passage, pulling it out without causing damage. That's the skill.
అంటే వింటుంటేనే భయం వేస్తుంది అసలు.
No. This is an extreme case, because this is one of those eminently satisfying procedure that I had done.
Saved the child's life.
Right. Saving the child at that point of time, the challenge is to remove it. You understand? That's your technical challenge. At the moment you're just looking at the thing, you're totally focused on the safety pin and how to take it out.
Wow.
You get my point?
Wow. Truly amazing. Okay, sir, moving on. నాకు ఎవరైనా సరే స్టెంట్ వేసారు అంటే అది హార్ట్కి అని నేను ఫిక్స్ అయిపోతుంటాను. బట్ దెన్ ఐ గోట్ టు నో, మీతో మాట్లాడడానికి బేసిక్ రీసెర్చ్ చేస్తున్నప్పుడు ఐ రియలైజ్ లంగ్స్కి కూడా స్టెంట్ వేస్తారు అని. ప్లీజ్ టెల్ మీ, వెన్ ఈస్ దట్ రిక్వైర్డ్?
What is a stent? Like, you need to understand what a stent is before I tell you what it's all.
Right.
Stent is a supporting tube which is kept within the air passage so that it continues to remain patent.
Okay.
If for some reason the air passage is narrowed, either because of a tumor or because of lack of support or because of a disease, the whole thing is collapsing like this or has collapsed, has become narrowed, our job is to open it up to be able to support his life. Okay. And most times it doesn't stay open. It will go back to its original thing. Till it heals, you put a structure, a tube, a hollow tube inside the air passage to facilitate healing around the tube, so that once the healing is complete, maybe sometimes it takes 6 months, sometimes it takes 3 years. By the time it becomes firm, then you remove the supporting structure so that they become okay. So this is the role of a stent.
Right.
For malignancies where the tumor is getting into the air passage, patient is unable to breathe, you put a tube inside to prevent it from coming into the air passage. This is mostly as a palliation for advanced cancer. When nothing can be done, they are not responding, they are unable to breathe. So for as long as he lives, you place a stent to at least give him that little bit of quality of life till the end. So this is palliation. People who are not surgical candidates, but who require this kind of a procedure, like a narrowing, what we call stenosis. If it is narrowed, we open it up and support it till it heals. Or tuberculosis, when the disease causes the tube to narrow down, we open it up and allow it to heal around the tube and remove the tube at the end of 1 year or something like that. So they continue to have a good life.
Oh. And because in continuation to that was, is it long term like with only temporary solution?
Sometimes it is used as a bridge for surgery.
Okay.
Sometimes as a definitive treatment. For about 1 or 2 years, you leave it and remove it. It heals, so you remove it. So it is a definitive solution. In some people, it is only palliative. So that end of life care, you give them support till they pass off without any discomfort, respiratory discomfort.
Oh. And also, sir, lung cancer patients, generally they present it late only. Kada. My question is, Meeru as a pulmonologist, what are the symptoms or warning signs that we tend to ignore?
If you know that you have a lung cancer, there is no question of ignoring anything.
అసలు ఇది lung cancer కాదని మాకు ఎలా తెలుస్తుంది?
No, that is when, if you are sick, you need to go to a doctor.
Okay.
Who's going to do the diagnosis?
Right.
Ante kada.
అంతే.
Don't take medicines which are prescribed empirically. Like there is a common tendency that, the shadow looks like tuberculosis, let us give him anti-tuberculosis treatment. If he doesn't respond, we'll send him to a specialist.
Okay.
That's where things go wrong. So no empirical treatment. Definitive treatment after positive diagnosis is the way to go.
మరి ఈ palliative care అనేది పిక్చర్లోకి ఎప్పుడు వస్తుంది సార్ విత్ రిగార్డ్స్
Palliation is cancer has stopped responding to your treatment.
ఓకే
Or patient has presented too late for anything to be done. So what we can't do to treat definitively, give him some relief at least.
ఓకే
That's the point.
ఓకే మరి ఈ ఇంటర్వెన్షనల్ పల్మనాలజీ అనేది పిక్చర్లోకి వచ్చి యూ థింక్ దట్ విల్ ఆల్సో సేవ్ పీపుల్?
Gives them relief definitely. For everybody it gives you relief. Interventions, we can prevent half of them from going under the knife, that is going to the surgeon. We can do most of the cases like that.
ఓకే
So we are a halfway house, let me put it that way.
రైట్
Between a physician and a surgeon, a interventional pulmonologist is a halfway house.
రైట్
He can do a lot of things which the surgeons don't want to touch,
కరెక్ట్
but give equally good relief.
ఓకే
Of course, there are definite borders which we don't cross. This is definitely surgical and it goes to the surgeon straight away.
కరెక్ట్
But there are a lot of gray areas.
రైట్
Supposing I don't find a good surgeon, then I do it myself. Okay. Tongue in cheek.
Yes. All right, sir. Now I'm moving on to the rapid care round.
Right.
Quick question, sir. Let's go. First one. Cigarettes or hookah, which is worse?
Devil and the deep sea.
Both are.
Both are equally hazardous.
ఈ మధ్యన కొత్త స్టార్ట్ అయింది కదా, all the youngsters vape.
Even that is very bad. In fact, it's worse than smoking because it gives you immediate effects.
A habit you wish every asthma patient would adopt.
Go to the doctor frequently.
Most overused pulmonology test.
CT scan.
Pulse oximeter at home, helpful or misleading?
Very helpful. Patient is trained to use it properly.
One myth about lung cancer you'd like to bust.
Not all cancers are fatal, and you need not be a pessimist when you deal with cancer.
All right. Okay. Nebulization at home, yes or no?
People who can't take it any other way, nebulization is the way to go.
Okay.
If you have an alternative, give the alternative first.
What's the worst air pollution season in Hyderabad?
Usually we would say towards the winter months because the smog and everything, the dew holds it down.
Yeah.
So usually I would say mostly during the winter months.
Finally, sir, what's your go-to tip for patients to keep their lungs healthy?
Avoid pollution as much as you can.
Is it possible, sir?
No, I was coming to that more clearly. Let me elaborate. make sure that the work environment is free of pollution.
Okay.
What is there in the city, you can't do much about it. Don't let anybody smoke indoors. Of course, that has come down significantly. Make sure that, your environment where you're working is pollution free. That is something that you need to ensure, and even at home.
Are humidifiers good at home?
They don't make so much of a difference now.
All right. Done. Got it, doctor. I got a lot of info. So I'm so glad I spoke to you. Next time నుంచి లంగ్స్ గురించి ఎవరికి ఏ డౌట్స్ ఉన్నా సరే we will come to you.
Okay. Thank you.
Thank you so much, doctor. Thanks again.
Pleasure.